7 minutes before top of the hour 9, you're still tuning into News and Views. Myself, Zanele Makwidiri. And we're going to be switching gears now to a very, very concerning conversation that rocked South Africa. The deaths of several healthcare workers in the KZN over the past year have shaken South Africa's public health sector, prompting allegations of toxic workplace cultures, institutional bullying, and just general deteriorating working conditions. Doctors, nurses, and even advocacy groups raised alarm, and they're essentially questioning whether unbearable pressure inside public hospitals was contributing to the tragic deaths of frontline healthcare professionals. And I think the issues around public healthcare in South Africa are well documented. We all know about them, and that specific issue in itself became so serious that Health Minister Dr. Aaron Motsoaledi requested an independent investigation by the Health Ombud, supported by, I think, former Parliamentary Health Committee Chairperson Dr. Sibongiseni Dlomo. Yes. And this week, the Health Ombud released its long-awaited findings. And while the investigations found no evidence directly linking the deaths to workplace bullying or systemic failures within the KZN's public hospitals, it also acknowledged broader challenges facing the healthcare system and made recommendations aimed at improving support for healthcare workers. The Health Minister, Aaron Motsoaledi, has since said the findings should serve as a catalyst for reforms across the public health sector. But for many families, healthcare workers, and unions, the findings may answer one question while raising many others. If workplace bullying wasn't the cause, what was? Are doctors and nurses still working under unsustainable conditions? And what responsibility does government have to protect those who spend their lives protecting ours? And joining us to try and answer some of those questions is Dr. Zanele Bikitsha, Vice Chairperson of the South African Medical Association. Doc, thank you so much for joining us. Always a pleasure. Good morning. Dr. Bikitsha, can you hear me? All right, we are not getting sound from Dr. Zanele Bikitsha. But yeah, if you're a health worker, I think there's someone, maybe you can engage with us. Our studio line is 01168000355. On WhatsApp, you can send us a voice note or a text message, 061-766-0355. And you can let us know the conditions at some of these public health facilities, and how difficult or how easy has it been for you being in the sector? I think we have Dr. Zanele Bikitsha back. Doc, can you hear me now?
Yes, I can.
All right, perfect. Thank you so much for joining us, Dr. Zanele Bikitsha. She's the Vice Chairperson of the South African Medical Association. I want to jump right in, but I'm sure you saw the Health Ombud yesterday having ruled out a direct link between workplace bullying and these tragic deaths that we've seen in the KZN of public health workers in recent years. From your perspective, was that the conclusion you were expecting? Does it reflect what health workers are telling you guys on the ground? Dr. Bikitsha? All right, yeah, we're struggling with sound when it comes to Dr. Bikitsha. I think we're going to go for a quick break, and then
Yes. Slylo, the first part, before we get caught up in this, I think we need to remember that, this is human life we are talking about. So as the association, we first need to acknowledge that, because this report... Okay.
I can hear you now.
Her network is bad. Let me call her.
All right, I think we're going to try and get Dr. Zanele Bikitsha on a different line because it looks like her connection is not the best. So we're going to take a quick, short ad break, and then when we come back, we'll try and continue with that conversation. Don't move. Join us after this.
Rejuvenating media day by day. This is Salam Media.
In the instance of this particular matter, you have both Israel and the USA, in spite of the evidence, believing that Iran wants to genocide Israel. And they said the same thing about Gaza, that Gaza would like to genocide Israel, and therefore they genocided first. Now, the problem with this is that the world ought to act at least on the basis of the evidence that is available to everyone watching this war, that for Gaza, the aggressor was Israel, the one who had every evidence for genocide was Israel, and that as a country we took Israel to court precisely because the evidence was overwhelming. Now, to go to war without overwhelming evidence that there is genocide intended against you is something that, not only because they break the law, the international law that exists, but also all moral sensibilities ought to be telling us that this sort of behavior is not a 21st century behavior. It belongs in the dark barbaric ages long ago where there was no rule.
Reverend Moas Ntla, a member of the National Executive Committee of South Africa's Council of Churches and also a member of the anti-apartheid movement.
This is Salam Media.
The misjoinder in people's minds, in the community's minds, is that they only got to see the mortuary battle, and the community felt, well, this is the mortuary battle, but that's absolutely wrong. Last week, Advocate Shamima Dali.
Connect and stay ahead with Salam Media. This is Salam Media, coming to you live from South Africa.
Welcome back. So tuned into News and Views, and we're still in conversation with Dr. Zanele Bikitsha, and we're trying to get her reaction on the health ombud's findings, essentially finding out that there was no link between KZN workers' deaths and bullying in the workplace, so a toxic working environment, if I can put it like that. Dr. Bikitsha, I hope you can hear me now. As you were, a quick reaction to the health ombud's findings and the report essentially saying there's no evidence of systemic bullying, but yet many healthcare professionals have spoken publicly about toxic workplaces in the public healthcare sector. Can you maybe give us your reaction, unpack what you guys are hearing on the ground? All right, I think let's get Dr. Bikitsha on the phone. I think that's what might work from now onwards, because I think the connection is really, really bad. So yeah, we'll try and do that after this.
Hello?
Dr. Bikitsha, can you hear me now?
Yes, I can.
All right, perfect. Yes. As you were, your reaction to the health ombuds report.
Yes, so as we were saying, our first statement needs to be that we are dealing with loss of human lives. So we must all take a second to acknowledge that. These are colleagues, fathers, brothers, sons. So we honestly need to acknowledge that when we understand what we're discussing. And in terms of our reaction, we need to pay attention to the phrasing. They do say there's no direct causal link, but the ombudsman then goes on to say that they have identified systemic failures that play a role in what is happening. And this is to the effect, of having severe mental impact in terms of wellness. It is overstaffing because of posts not being filled. It is not having infrastructure, not having SCM, processes in place to be able to support, not having clinical governance, to play the kind of oversight role it should. So these are critical areas that he has identified and said must be addressed as a matter of urgency. So we cannot lose track of that, because he has said that these are the pressure points that we need to address within the health sector. And just to remind us all, colleagues, above this investigation, we also in the past 2 months, have lost within KZN just 3 colleagues to self-harm. So something is fundamentally wrong in what is happening within the Department of Health when it talks about how we are managing our human resources.
I want to come back to the report, and obviously its underlying or key finding is the fact that there's no evidence of systemic bullying in the public health sector, and as you mentioned, many healthcare professionals have spoken quite publicly about toxic workplace environments. Is it possible that both of these scenarios, both of these things can be true at the same time?
No, absolutely. One thing we will say as the Medical Association is a good thing. We don't agree that there's no bullying. There definitely is bullying within, the workspace. We actually have termed it academic bullying because you need to understand the dynamics. There's a hierarchy when it comes to titles within doctors. You start off as an intern, then become a ComServ, then an MO, registrar, then you're a consultant. And that is a level of hierarchy where, we are taught, to submit to our superior. And that is known, it's something that's there, and it's something that we've had to call out, because you must remember that it's done within our ranks of members because we represent all levels. So we want to disagree with that, but with the understanding that it's difficult to actually quantify bullying, so that might be where the challenge is. And you also need to take into consideration that a person might not be comfortable to disclose, given Uguti, they remain within the same environment, and whether they want to specialize or not, they will be dealing with the same superiors and supervisors in terms of academic progression.
There was something interesting and I think very, very important that the health minister, Dr. Aaron Motsoaledi, mentioned. He said that, the findings from this report should prompt reforms within the public health system. From SAMA's perspective, from you guys' perspective, what reforms should be implemented immediately, rather than, this report becoming another report that just gathers dust, that doesn't see real lived changes in the public health sector?
Okay, yeah, no, this report cannot become another Zondo commission. It cannot become, some reports decorating a shelf somewhere. And we're taking it on ourselves to ensure that the actual recommendations, because there are recommendations on the report, that those need to be implemented. Now, the challenge is, you've got transversal issues which are not necessarily province related, but as a result of national discourse, which then obviously we need to locate with the minister and will engage. But within the province, we need to see certain things happening. So we will be following up with the DOH, but what we would expect clear, plans and outlines is, one, what is the current status of our vacancy rates? Because we understand that posts have not been getting filled because of austerity measures. We need to know where we are, and we will then use that status and mark ourselves against the barometer of international norms and standards for staffing. So that needs to be the next goal, to say there must be an adopted staffing norms, because it's very weird that there isn't one that is actually adopted, even though there is recommendations from the World Health Organization which talk to how many practitioners you should have per patient. So having understood the vacancy rate and where we are, we need to then adopt the staffing norms and see what is the gap, so that there can be a plan made together with Treasury to fill in those deficits. So I think that's definitely our number one goal, to actually get the paperwork started. Then when it comes to now employee wellness, we know that even within the province, not all institutions have direct access to EAP. So that program needs to also be revitalized. We need to have the understanding, how are we going to ensure that there's access at every facility to EAP? And that must happen. It mustn't just be something that we're planning to do. There must be a clear referral that if there's an institution and there's a problem, this is who this person is going to be covered by in terms of employee wellness. And then, because that's going to deal with a lot of the mental strain that we are having. When it comes to the issue of supply chain management and aging infrastructure and things like that, those are serious conversations. I think here it's even beyond the province at this point. We need intervention. You cannot have facilities that currently are trying to operate with equipment that is past its shelf life, and you're expecting save patients like that. I think this one needs an urgent, whether you want to call it an indaba, but we need to have an urgent call to say hospitals within the province, are they safe? What is the critical equipment that is currently needing to be replaced? Because there is asset registers, so that we can make an immediate application to ensure that Treasury gets a special dispensation to be able to address this. These are the kind of suggestions that we'll be trying to put forward to assist in getting this solution sorted, with the DOH. We understand that when we engage them, they always do cry matters of austerity, but also we cannot then 100%, take away liability from them in terms of oversight. But we are prepared to ensure that those immediate reforms start.
I want to come back to, just grounding the conversation a bit. You spoke about, employee wellness, and mental health, feels like it's at the core of this conversation. Do you believe, we take the mental health of healthcare professionals seriously enough in South Africa, or is there still an expectation that doctors and nurses simply cope because of the profession that they've chosen?
Yeah, absolutely. I think I was just commenting yesterday that mental health is always a background. Even if you look at how our psychiatry services are, having problems currently in KZN, you can have a whole, psychiatric hospital with no specialist. So mental health is always seen as an afterthought. So that is true. Mental health is never ever prioritized. And you are telling the truth when you say, Kuti, health professionals are just expected to soldier on and be able to deal with what they see on a day-to-day basis. Remember that we see trauma, we have horrible, experiences. We put our bodies through the line because we must be there 24/7. And one of the biggest examples of what you're trying to say, look at what happened in COVID. The health was just expected to soldier on, and there was no special intervention put in place to say, how do we support you mentally through this? Because we ourselves, we're having to deal with the reality of the pathogen, having our family members away from us, having our colleagues dying every day. And there was never a plan to support us at that point in time. And it happens even now where, you'll have a death and you must just see the next patient in the line after you've finished your research and made your notes. So definitely we are expected, to be tough. But I think this is highlighting that we need to take a better look at how we are treating our employees and ensuring that they're fully supported within, their workspace in terms of mental health and resourcing.
Very, very important to note. I think for a very, very long time, South Africa has previously relied on the health ombud to expose some of these, major failures, especially within the public health system. One thing's of, the Life Esidimeni tragedy, to just general hospital governance issues that we're faced with. Does this latest investigation strengthen confidence in the ombud's independence, or do some healthcare workers and healthcare workers organizations remain unconvinced?
Yeah, I think a lot of us, we were expecting, the ombudsman's report perhaps to be a little bit more scathing and have a bit more teeth, because there are certain areas that we feel were not aggressively, addressed. But we cannot then take away from the fact that this process has been launched and this investigation has been done. At least at the face of it, suggests that we are now at a level where we understand that there does need to be reforms, there is a problem, and we are then getting to the part where we're going to start working on making the necessary reforms. So we'll take it in good faith, as much as there is a tepid response from our members, because you understand that we live with certain realities on the ground, but in good faith we understand that this is going to be a starting point. And what we will, though, not accept is that after this, there is then absolutely no action. And 5 years down the line, we are still commenting on the Ombudsman report and recommendations. This needs to find its way onto the ground, into the actual, ground floor level, and meaningful reforms need to be made.
No, most definitely, Dr. Bikitsha. Thank you so much for your time and your insights. Really, really appreciate it.
Okay, no, thank you very much.
There we go. And with that, we're going to take a quick break. News and views will continue after this.